Rahim. Assalamu alaikum. I am here from Conceptual Medicos, and today in this lecture we will be talking about the NSAIDs, which means non-steroidal anti-inflammatory drugs. Before going to the classification and mechanism of NSAID, first we should review some steps of the biochemistry regarding the synthesis of the prostaglandins and leukotrienes. So, the basic precursor for the synthesis of prostaglandins and leukotrienes is arachidonic acid, which is a 20 carbon non saturated fatty acid. It is derived from the membrane phospholipids by an enzyme known as the phospholipase A2. Now, when this arachidonic acid is formed, it goes either through the cyclooxygenase pathway or goes through the lipooxygenase pathway. When it goes to the cyclooxygenase pathway, it either goes through COX-1 or through COX-2. The cyclooxygenase So the COX-1 is the enzyme which is normally present in the tissues like vessels and the kidneys. So it is a constitutive enzyme which is working normally in the body. It produces uh, prostaglandin I2, which is also known as prostacyclin, which is basically a vasodilator and also a platelet aggregation inhibitor. The second one is prostaglandin F2 alpha, which has main role in decreasing the intraocular pressure and also the induction of the labor. The next one is the prostaglandin E2, D2, which are vasodilators, and thromboxane A2, which is basically a platelet aggregator. The second one is the COX-2. The COX-2 is the inducible enzyme. It is not present normally in the body, but it is produced when there is some inflammation in the body. So it will form thromboxane A2, which is a platelet aggregator, PGE2, tumor necrosis factor alpha, interleukins, and bradykinins. And these factors are responsible for the cardinal signs of the inflammations, such as pain, such as swelling, etc. etc. Now, the arachidonic acid, when goes through the lipooxygenase pathway, then they form the leukotrienes, which is main role in the asthma, and which will be discussed in the next lectures. Now, coming towards the classification of the NSAIDs, so they are basically divided into four groups. The first one is the non-selective COX inhibitors. Non-selective means these drugs will act both on COX-1 and COX-2. The second one is preferential COX-2 inhibitors. They will preferentially act on the COX-2 enzyme to inhibit it. The third one is highly selective COX-2 inhibitors, and the fourth one are those drugs which have analgesic and antipyretic properties, but they are poor anti-inflammatory drugs. Now coming toward the first one, which are non-selective COX inhibitors. So they are further divided into 5 subgroups. The first one being the salicylates. They include two main drugs, which is aspirin, which is the most important one, and diflunisal. The second one is the propionic acid derivatives like the ibuprofen, naproxen, and florbiprofen. The third one is the phenamic acid derivatives, which include mefenamic acid and flufenamic acid. The fourth one are the acetic acid derivatives, which contains the indomethacin and ketorolac. The fifth one are enolic acid derivatives, which are piroxicam, tinoxicam, and loroxicam.